This month, February, is National Cancer Awareness Month, and as your dermatologist, I wanted to talk about skin cancer. Skin cancer is the most common type of cancer, and it's said that 1 in 5 Americans will develop skin cancer by the time they are 70 years old. And that's why regular skin exams, focusing on sun protection, and self-exams at home are so important. Some prevention tips on skin cancer are going to include sun protection, of daily sunscreen, regardless of whether or not it's winter, SPF application every 2 hours while outdoors, along with UPF clothing, hats, and sunglasses, regular self-exams at home, focusing on your back of your legs, and bottoms of your feet, as those are areas you often don't see. And if you notice any moles that are changing in size, shape, or color, or any lesions that are not healing or they're bleeding, then you should be examined by a professional. Early detection saves lives. So make sure this month you get your skin exam, you're checking yourself at home, and if you notice anything that's changing, get evaluated by a dermatologist. And don't skip the sunscreen, get that into your regular routine. Lip filler is typically made of hyaluronic acid, which is a substance that our own body produces to create kind of a natural plump look. Lip filler does not have to be painful. So I use a very strong topical numbing here, and I also numb the inside of the upper lip, which makes it very, very comfortable and almost pain-free. Lip filler, if you're using a hyaluronic acid-based substance, can be dissolved. We have an enzyme called hyaluronidase that can be injected, and it will dissolve the lip filler that your body normally breaks down on its own. Swelling typically lasts up to about 48 hours, but your final result will be in about 2 weeks. Bruising is variable. Some people have very minimal bruising, whereas others can get more bruising, and it can be very difficult to assess who's going to bruise and who won't. Most bruises can be covered with makeup and resolve on their own within about 7 to 10 days. Lip filler is a subtle thing. You don't need a lot. Most people are going to use anywhere from a half a syringe to a full syringe. I don't ever inject more than 1 syringe per visit, and if you're looking for a natural result, you'll never need more than 1. Lip filler can last anywhere from 6 to 12 months, depending on how quickly your body breaks it down. You won't have it completely eliminated at the 6-month mark, but it will probably start to break down on its own. So you may want to do your lip filler every 9 to 12 months. This month, I wanted to talk a little bit about rosacea. It's one of the most common skin conditions I see, and it can be triggered in the winter months. It's really an inflammatory skin condition that is characterized by facial redness, flushing, and sometimes acne pimples along the nose or the central cheeks. And it can be triggered in winter months because it's driven by inflammation and a weakened skin barrier. And the cold and the heat from the indoor, as well as the wind, can kind of trigger rosacea flares. The goal to treat it is to really focus on gentle skincare and avoid harsh or exfoliating ingredients. So focusing on moisturizing consistently, using active ingredients like ceramides, lipids, or glycerin, or even niacinamide if your skin can tolerate it. Don't skip the sunscreen. Rosacea patients tend to do better with mineral-based sunscreens. Things like zinc or titanium is the active ingredients. And there's a whole bunch of different topical prescriptions and oral treatments that can help get your rosacea under control if the over-the-counter gentle skincare isn't helping.